so this is another healthcare video, and in this one I'm going to cover what to do if you see or suspect blood in your guinea pig's wee and how urinary tract infections are diagnosed and treated. And this is because we recently had yet another vet visit, again for Twiglet. It's always Twiglet for this exact reason. So on Friday night I spotted blood in her urine, and on Saturday we took her to the vet. So I'm going to focus on urinary tract infections, but it is worth knowing that bladder stones are also a common cause of blood in your guinea pig's urine. If you want to know a bit about bladder stones, then eventually I will have a separate video covering bladder stones and the kind of treatment for those. But for this video we're just going to be looking at urinary tract infections, or UTIs. So what are UTIs? They're basically when bacteria gets into the urinary tract or gets up to the bladder in guinea pigs. And unfortunately for guinea pigs, they are quite susceptible to them, which we can kind of work out just by looking at them and their stubby little legs. So guinea pigs are naturally low down to the ground, and some of them have awkward habits of sitting in their own pee and poo and generally not being the cleanest of animals. So one of the main symptoms of UTIs is having blood in their wee. Normally guinea pig wee is kind of a yellowish to whitey coloured liquid. It can be quite cloudy, which is normal. Guinea pigs expel all excess calcium in their urine, so that's what gives it a cloudy appearance sometimes, and when it dries, that's what might give it a kind of white powdery deposit. Urine that's got blood in it is going to be a pinkish tinge, which is not normal for guinea pigs, or if it's got an awful lot of blood in it, it can be bright red. And in Twiglet's case, it was very, very red. In fact, so red it looked not really like wee at all, it just looked like blood. So naturally I was very worried. Other symptoms that might suggest a UTI are being in pain or squeaking when they're urinating. And what I also noticed with Twiglet, she wasn't squeaking in pain, but she was urinating more frequently. So just like when humans have cystitis or something like that, it makes you want to go to the toilet more even if you don't need it, and that's because your urinary tract, your bladder is all irritated and inflamed. So just the same in guinea pigs, they go to the toilet more frequently when there's something not quite right. So if you see these symptoms in any of your guinea pigs, then you should get them to the vet at the earliest opportunity. Like with any health problems in guinea pigs, time is such an important factor. So if you suspect something is wrong, then don't hesitate, take them to a vet. And ideally the vet should be one that is an exotics trained vet who has a lot of experience with guinea pigs. If not, then a normal vet who sees small furries on a day-to-day basis and is very familiar with their health problems. Or if not, a normal vet, but you should go with the knowledge of the medications that they should be prescribing. If you think that's a bit over the top, then I can tell you from my own experience that I went into a vet's and let a vet prescribe an antibiotic that killed one of my guinea pigs, and only when I researched that drug later on, when it was already too late, did I learn that that was a highly dangerous medication to give to guinea pigs. So although vets are highly trained these days, things like that still do happen, and that's why you should always go to an exotics trained vet or a vet which is very experienced in treating guinea pigs over a normal vet who might just have training in cats, dogs and horses, for instance. So when you take your guinea pigs into the vet will listen to you why you suspect there's a problem. You should also pick up your guinea pig and kind of feel for any problems that there might be with the bladder. So I don't know how they do it, but the vets are kind of trained to have a feel, and they can identify the different organs, and they can tell if the bladder is kind of swollen or irritated in any way. Another thing that might happen is if you're lucky and your guinea pig wheezes on the vet's table, then they should say, oh, can you take them for a second? And they should get a urinary dip test kit out, which is just little strips of paper with different categories for different levels of different substances that you can get in the urine. And this is what the vet did for Twiglet. Put the paper onto the wee that Twiglet had excellently done for us on the table. And lo and behold, it still showed that Twiglet had a lot of blood in her urine. And what the vet should do is kind of consider things like the age of the guinea pigs, whether they've had any bladder stone issues before, and whether they'd had any similar symptoms like this before. They might even ask you about their diet if they're kind of wondering whether they get a lot of calcium in the diet. But usually, first thing they'll do is treat for a urinary tract infection, and if that's not successful, then they'll investigate bladder stones. So treatment of urinary tract infections should involve a painkiller or anti-inflammatory paired with an antibiotic to get rid of the bacteria. Normally, here in the UK at least, Baytril is the only licensed antibiotic for guinea pigs, so that's what vets will usually go for over anything else. My vet actually gave me an option of either going for Baytril or Septrin, and from reading up on the internet I knew that Septrin was favoured by some people over Baytril for treating urinary tract infections, and I was also aware that Septrin is like a banana flavoured syrup and guinea pigs prefer the taste of it to Baytril. So I kind of explained that what I'd read, and I also said that I would be away and it would be my boyfriend giving Twiglet her medication. So it might be easier for him if it was this nice tasting Septrin one instead of the horrible Baytril, which no guinea pigs like that. When I explained that, the vet kind of agreed that it was better for Twiglet to make sure she was getting all that antibiotic that she needed into her, and she actually prescribed Metacam for pain relief and anti-inflammatory, plus the Septrin as the antibiotic. So those are the drugs that you should be expecting to get from your vet to treat a urinary tract infection. Metacam for the pain plus antibiotic, which 99% of the time will either be Baytril or Septrin. If you've done some reading up on antibiotics and the one that they've given you is something you're not familiar with, you've not heard it mentioned before, then please question the vet, and if they're an inexperienced vet, then they might have prescribed something which is not actually suitable for guinea pigs. As I've said previously, from my own experience, I know that this does happen and the outcome is not good. So don't be afraid of questioning your vet. Any vet should be open to questions and queries about why they've prescribed this or why they think that might be a problem, so they should be more than happy to answer your questions. So I think that covers everything for this video. I hope you found it useful and you've learned a bit more about the symptoms, diagnosis and treatment of urinary tract infections in guinea pigs, and you now know what to do if you see or suspect blood in your guinea pig's wee. So if you found this video useful and you thought it was a good source of information, then please give us a thumbs up. That will help others see the video and help our channel. If you haven't already, then please subscribe and leave a comment if you've got any questions. I will try and get back to you. So thank you so much for watching. That is goodbye from me and Twiggie, who is hopefully going to get better, and the other piggies, Lyra, who's asleep, and Willow, who's also asleep. Surprise, surprise. Okay, that's bye from us. We'll see you in the next video. Thank you for watching. Bye bye.